Hi everybody, it's Dr. J. It's Q&A with Dr. J today. It's gonna be about taking care of your teeth so you can avoid that dreaded word that everybody does not want to hear in your dental visit. Any guesses? It's the cavities, right? Like, who wants to come into the practice and say, oh my God, you've got cavities? So today we're going to talk about what is a cavity. I'm sure millions of you have heard the word, oh, you've got a cavity in your tooth, you've got an infection in your tooth. Today I'm going to try, in my own words, explain that a little bit better for those of you who are still kind of confused about that, and maybe get to understand the word cavity a little bit more and get an understanding of what it is that it means to have a cavity, what you can do to prevent the cavities that do occur. Or at least maintain your health better so you get fewer cavities as you become a more knowledgeable patient and can care for your teeth better, right? So let me show you a model that kind of better describes what a healthy tooth is, and then we can go into the cavity part. So here you go. This is what a healthy tooth looks like, and I'm going to kind of come off to the side so I can kind of walk you through. This is the part above the gums that you normally see, all right? And this is the outer part, which is the white part of the tooth that you normally see in the mouth. That's called the enamel. And the inside part is the dentin, and the very inside core of the tooth is where the nerve and the nutrition supplies that keep the tooth healthy reside. That's called the pulp of the tooth. Now, when you're cleaning your teeth, you're mostly brushing the stuff above the gums. That's the white part, that's the enamel, and you're keeping that clean. Now, if you're doing a great job at brushing, you're kind of helping maintain your tooth better. But if at the same time, let's say you're not able to maintain the oral hygiene that is optimal for you, let's say you've got a less than optimal oral hygiene, or let's say you've got heavy intake of calories like soda pop, coffee with 10 times a day coffee with 2 milks and 20 sugars, then you'll probably hear this word, hey, you've got some dental cavities in your mouth at your next dental visit, or you may have already heard it. So what does that mean? What is a dentist looking at when he's telling you the word, or she's telling you the word, hey, you've got some cavities? This is what we're looking at. So on the flip side, when we're looking at cavities, we start to look at some of these things, right? Like we start to see these dark areas in your teeth, maybe on the sides of the tooth, somewhere near the gum line is, or on the top of the tooth. If we look, we start to see some of these dark areas here. Or you may also notice that on the side of the tooth, you'll start to see some of these dark areas where it's starting to kind of, the bacteria that reside in our mouth start to use the sugars from our diet to kind of burrow into the tooth and kind of start eating away the tooth structure. And that's what's called having a dental cavity, or dental caries, which is just another synonym for that. So why is it that having cavities is a problem? Why does it need to get fixed? Well, let's get into it. Just like I showed you earlier, the healthy part, a healthy tooth with the parts of the tooth. Now I'm going to show you what a cavity can do. A small cavity that only stays within the enamel part of the tooth, which is the white part of the tooth, can be easily repaired. Okay, we can clean out the surface, fill it up with a nice dental bonding material, and this tooth is repaired and it stays healthy. Kind of like repairing a puncture in a tire, right? Clean it out, repair it, fill it up with air, it's good to go. Same thing, clean out the dental cavity or caries, repair it with some nice tooth-colored bonding material or a silver filling. Hopefully in this day and age, we're choosing to go with more tooth-colored fillings, and they look nicer, and I think they last just as long, if not longer. Now, if the cavity is not shallow, but it's a little deeper, then it starts to get into the yellow pulpal part of the tooth, and that's when you start having pain, right? And that's when you start having more sensitivity, more discomfort, pain, and basically it's just your tooth telling you, hey, we've got a problem, buddy, let's take care of it. So hopefully you make the appointment at the right time, come in, we may still be able to just fill this tooth, or if the tooth has become hyperreactive because the cavity has gotten really deep and very close in the nerve, or may already be into the nerve of the tooth, you see this darkness kind of not only burrowing through the yellow pulpal part, but going into the actual nerve and the pulp and the nutrition supply of the tooth, and kind of going down the canal system of the tooth. That's when you know that, hey, listen, in the second option here, or the third situation here that's been created, are very, very likely that they may end up needing root canal treatment. All right, so I'm sure you guys have heard of that as well. What is root canal? I'm sure that's a procedure that some of you may have already had, and we'll dig into that treatment a little later. Maybe another video. That's a good idea. I think I just came up with, but let's focus on this right now. Hopefully, you get to us before the nerve of the tooth is affected. Hopefully, it's still in, you know, situation 1 or 2 where it's still treatable without you needing a root canal. I'm not saying that 2 is not going to need one, but sometimes it does. So hopefully you get to us in time and we're able to take care of you to avoid this kind of, you know, deeper decay, deeper infections that need more involved and invasive work. So that was a good, hopefully that gave you a good explanation of what a cavity is, how it starts, and what are the options, what are the treatment options, what needs to be done to take care of your tooth in order to help maintain that tooth, and how to take care of a cavity once you get it. Of course, there's a lot more details to this, and we'd be happy to go over that with you once you kind of come in and review our options with us. For example, you know, depending on the size of the cavity, it may need to be filled. Depending on if the cavity gets larger, it may need to be crowned, or an onlay may need to be done, or a veneer may need to be done. It really depends on which tooth has that cavity, how large is the cavity, what is the function of that tooth, how does your occlusion look like, which is a whole different topic, and I'm sure we'll get into it at a different Q&A session with Dr. Jay at a different day. So hopefully you guys enjoyed watching this explanation of dental cavities. Got a little bit more information about cavities. Of course, we can peel that onion back a lot more and get you a lot more information, but that's for another day, and we'll definitely get back to, you know, getting to know your teeth and how to take care of them and preventing cavities. Maybe we'll do a part 2 of this video. So until then, this is Dr. J signing off for a Q&A session. If you have questions or comments, feel free to leave them below. Don't forget to like our Facebook page, check out our Instagram as well, and leave your questions and comments, and we'll get right back to you. If you're looking for a dentist, to make sure you get your dental hygiene visits and get yourself checked out, make sure your teeth are healthy, give us a call, Media Dental Associates, Bootway Dental, or Conshohocken Dental Arts. We are ready and waiting to take your phone calls and set up that patient appointment to give you an amazing experience here. Until then, this is Dr. J signing off. Take care. Have a great day, guys.